new report is shedding light on the state's mental health across the country.
It shows a rise in deaths among people in Tennessee. Thanks for joining us tonight. I'm Kim Chapman-Whitfield.
And I'm Josh Rowe. According to the Sycamore Institute Study, 13% of Tennessee high schoolers have attempted suicide. 13%.
And within the past 10 years, medical experts say twice as many adolescents have died between the ages of 12 and 17.
News Channel 9's Leslie Dominique joins us now in studio with a deeper look at those recent numbers.
And she shares why one local health expert says that data is inaccurate.
Yes, Kim, Josh, it is National Suicide Prevention Week, and a new study from the Sycamore Institute has discovered shocking numbers about youth suicide in our state. But one local expert says that data does not paint the full picture.
I'm speaking as a mom now. I have twin 11-year-olds, and they have experienced this with their peers. They've come home saying, "Mommy, so-and-so was talking about suicide."
Every year, Suicide Prevention Week brings attention to the national mental health crisis. But a new Sycamore Institute study is painting a greater picture of the reality of suicide amongst Tennessee teens. The study finding that in 2021, nearly 1 in 4 Tennessee high schoolers seriously considered attempting suicide. More than 1 in 10 tried, and 39 adolescents 12 through 17 died from suicide.
Because that's a scary thing for anybody, child or adult, to even think. Because when people have suicidal thoughts, they don't even know why they have them.
But as shocking as those numbers may sound, Eve Nite with Chattanooga nonprofit CIT Connect says the data is not completely accurate.
Our mental health data is inherently sexist and racist. And so when you look at this data, I hope that you take it with a grain of salt, realizing that the true problem is far greater than our data is even suggesting.
Knight says it is resources for teens that make all the difference. The Sycamore Institute found that access to school-based mental health personnel varies county to county in Tennessee, with Hamilton County far from the lead. But CIT Connect does training for law enforcement, first responders, community agencies, and anyone that interacts with someone who might be in a mental health crisis. It's also about providing tools to parents who may not have all the answers.
We need to ask parents, what do you need? What do you want? How can we help? Instead of decide that for other people. Parents feel so blamed and shamed.
Dr. Lisa Pion-Berlin is the CEO of Parents Anonymous, a nonprofit that provides free mental health services through support groups and its national multilingual helpline.
Nationwide, we don't have enough clinicians. We don't have enough licensed clinicians. You're going to have to fight for your child.
Hamilton County Schools tells us all educators are required to complete a training to identify signs and risk factors of students who may be struggling. The district also implements Mental Health 101 for middle school and high school students. Kim?
Leslie, thank you. While suicide is on the rise among teens, the CDC says adults with disabilities are 3 times more likely to consider suicide than people without. Medical experts say this is a group that often is overlooked. Most research efforts are focused on finding cures or preventing disabilities from happening, but Dr. Lauren Chasm says there needs to be a focus on suicide as well because of the perceived burdensomeness.
This idea that if I were to die, it would benefit other people more than if I were to continue living. And we find that this is consistently heightened among people with disabilities across different disability types, younger adults, older adults.
Dr. Chasm has been testing cognitive behavioral therapy for suicide prevention using telehealth so it can provide to anyone, anywhere, at any time. She also says making communities more accessible would help remove some of the disparities that keep people with disabilities from being able to freely enjoy where they live and maintain independence.